Hello everyone. Today we are going to look at mental health and psychiatric nursing. And there's no how we can talk about mental health without bringing in anatomy of the brain. It's the brain that directs. So anything that happens to us in the brain, it means there will be a mental illness. So anatomy of the brain, an overview. The brain is an amazing 3-pound organ that controls all functions of the body. The brain can interpret information from the outside world and embodies the essence of the mind and soul together. The brain has an intelligence, the brain has creativity, it has emotion and memory, are a few of many other things governed by the brain. The brain is also protected within the skull. The brain is composed of 3 organs, which we have the cerebrum, the cerebellum, and the brainstem. The brain receives information through our 5 senses. We have the sight, the smell, the touch, the taste, and the hearing. So when once these organs have disorder, it means there is something wrong with the brain. Often many times at one time, the brain also assembles messages in a way that has meaning for us and can store that information in our memory. I want to say that the brain is like a computer that can store so many things. The brain also controls our thoughts, memory, and speech. It also controls our movement of the arm and legs and the function of many organs within our body. We also have the central nervous system, which is also composed of the brain and the spinal cord. The peripheral nervous system is also composed of the spinal nerves that branches from the spinal cord and the cranial nerves that branches from the brain. What is this brain? Brain is composed of cerebrum, cerebellum, and the brainstem. The cerebrum is the largest part of the brain and is also composed of the right and the left hemisphere. It performs a higher functions like interpreting, touch, vision, hearing, as well as speech, reasoning, emotion, learning, and fine control of the movement. While cerebellum is located under the cerebrum, its function is to coordinate muscles, movement, maintain posture, and balance. While the brainstem also acts as a relay center connecting the cerebellum and the cerebrum to the spinal cord. It also performs many functions, which is called the cerebrum. That the cerebrum performs many automatic functions such as breathing, heart rate, body temperature, awake and sleep cycle, digestion, sneezing, coughing, vomiting, and swallowing. That is the function of cerebrum. We also have the right brain and the left brain. The cerebrum is divided into 2 halves, the right and the left hemisphere. They are also joined together by a bundle of fibers called corpus callosum that transmits messages from one side to the other. Each hemisphere controls the opposite side of the body. If a stroke occurs on the right-hand side or the right hand side of the brain, your left hand or the leg may be weak or paralyzed. Not all functions of the hemisphere are shared. In general, the left hemisphere controls speech, comprehension, arithmetic and writing. The right hemisphere controls creativity, spatial ability, artistic and musical skills. The left hemisphere is a dominant in hand use and language in about 72% of people. We also have lobes. You also have lobes. The brain has different lobes. We have the frontal lobe. What is the function of the frontal lobe? It has personality, behavior, emotion, judgment, planning, problem solving, speech, writing, body movement, intelligence, concentration, and also self-awareness. So that's the work of a parietal lobe. We also have frontal lobe, also have parietal lobe. The function of the parietal lobe has to do with interpret language, words, sense of touch, pains, temperature, sensory trips, interpret signals from vision, hearing, motor sensory, memory, spatial, and visual perception. While occipital lobe has to do with interpretation of vision, color, light, and also movement. Also have lobe, occipital lobe. What's the function of occipital lobe? Which I have rightly said. Now we are looking into temporal lobe. Temporal lobe has an understanding, language, memory, hearing, and also sequencing and organization. So these are the function of the lobe that has to do with brain. We may not go into the brain because I believe that you have done it already in your anatomy and physiology. We have these structures here. We have pituitary gland, we have thalamus, we have all the organs as you might mention it. So when you go into your book, you see the features of the brain. So now we are just looking at the surface and know which one that you can know best. But the main thing we are in here to do, we have to talk about mental health. So we are looking into the meaning, the scope and historical survey of mental health. What is the meaning of psychiatry? Psychiatry or psychological medicine is a branch of medicine that deals with diagnosis, treatments, and the prevention of mental illness. And what is mental illness? Mental illness is an illness characterized by a breakdown in the mind, pattern of thoughts, speech, emotions, and behavior of an individual. And that will take us to the branches of mental health. We have different branches. The practice of psychiatry focuses on every human endeavor, and the following are: number one, we have child and adolescent psychiatry. This refers to the practice of psychiatry within the age of 0 to 18 years. Number two, we have geriatric psychiatry. This is the practice of psychiatry among the old or senior citizens. Number three, we have forensic psychiatry. This refers to the laws governing the practice of psychiatry. Number five, we have military psychiatry. It is the study of how military men are mentally healed but still functioning in the organization. We also have occupational psychiatry. This refers to the influence of the working environment has on the mental health of the workers and those who have mental problem function. The list, we have community psychiatry. This is the practice of psychiatry within the community. So we all have other branches of psychiatry, but we are able to bring out these 6 that we can actually deal with. And that will take us to the historical survey of mental health. Mental health is the oldest ailment in the human history. Evident to these dates backdate to the historical or biblical period. In the book of Daniel, in the Bible, it was reported that King Nebuchadnezzar, who was believed to have been caused by God, lived in the bush like an animal, eating grasses, leaving his nails uncut. That is a mental disorder in that patient imagining himself to be a wolf or a wild beast. Also in New Testament, Jesus hated a demon-possessed man who was presented with what it appears to be a symptom of mental illness. Generally, in the history of psychiatry, we have different eras. We have the mythological era, we have humanitarian era, and also scientific era, which we are going to deal with one after the other. In the mythological era, this period, also known as the Dark Ages, occurred in 400 AD, 1400 AD. The general belief during this period was that mental illness was caused by demon or evil spirits. So this belief influenced the way the mentally ill patients were treated. Most of them were subjected to inhuman treatment like beating, including boring of holes in the head and chaining them. In Africa, some of them were sold into slavery. However, they were ancient contributors or contribution made in Egypt to the development of psychiatry. In Egypt, there's a man who was a priest, physician. He lives at about 250 BC, converted his temple into a medical institution for the case of the mentally ill patient. He used a form of verbal from where psychotherapy developed. Greece was the first seat of civilization. Therefore, the Greek helped in highlighting others in the mental illness during the Dark Ages. One of the great philosophers called Hippocrates had the following ideas about mental illness. And what are the ideas? He believed that the brain is the organ of mind responsible for feeling and thought and not the heart or diaphragm, as previously suggested. He also advised that sickness should be looked at as a violation of natural laws. He also recognizes the connection between depression and cheerfulness, now regarded as manic depressive psychosis. He also went further to discover insanity coming from hemorrhage, infection, and childbirth, now known as puerperal psychosis. He also took the mentally ill to his hospital and treated them in various ways. He uses fresh air exercise or vapor bath as treatment methods. In 30 AD, you have another great man who is Calcius, recommended the use of gentle massage and narcotic in the treatment of psychiatric patients. During the Dark Ages, also came an era described as witchcraft era. This appeared to be the highest period in the history of psychiatry. This period witnessed a situation whereby the slightest sign of mental illness was regarded as witchcraft, and the individual was immediately burned to death. Also, married men who went for other people's wives were considered to be bewitched, and they were also burned alive. One German executor was able to burn 2 women alive in one day. So in England, Queen Elizabeth I made witchcraft punishable by death and paid fee to men for each witch or wizard burned alive. After the Dark Ages, new ideas about mental illness developed among the Hebrews, such as lunacy, that caused changes in the face of psychiatry. Also take us to another era, which is no other era like the political era, starting from 1400 to 1774 AD. After the death of those gentlemen, a new treatment modalities were added, which included administration of purgative concoction to induce severe vomiting, all in the attempt of getting rid of the evil spirit. Some continue to bore holes in the head, that is carrying out craniotomy, for the demon to merge. Because of this maltreatment, King George I of England passed a law to protect the mentally ill victim in 400 AD. And later, Edward II passed a law to protect their property in 1403 AD. The first place, aside for the care of the insane, was a small post, originally a convent founded by the sister of St. Mary, Bethlehem. It was converted to Bethlehem for the care of the insane. This place could only contain 6 inmates, and the patients were no longer exposed to the public fun. As time passed, some hospitals were set aside for the care of the insane. These places were not, however, better than prison. The places were damp, dark, and unventilated. The place where the inmate sleeps were never washed, changed, or cure diseases such as infection and worm infestations were common there. The inmates in the house were also chained, beaten, and choked up behind iron bars. One of the most inhuman treatments was exposed to the public as a form of fun, and admission was granted through ticket to visitors to view the patient. Men and women were bounded together, and the most unfortunate ones were thrown into the place, never to see the outside world again. As far as the society was concerned, it was believed that as long as the insane were housed and prevented from disturbing the rest of the mankind, the government has done its duty. Another era came, which is the Humanitarian era, that started 1774 to 1891. The first humanitarian reform in the case of insane took place in England and France towards the end of the 16th century. In 1760, King George III of England had mental illness and was outwardly converted to Bethlehem, where he was treated like any other inmate. Some members of the government and others were other very important persons who visited observed how inhuman the victims were handled and what happened. They protested. At the same time, private physicians who took interest in caring for the insane petitioned to the government and asked for permission to treat the patient the way they thought best. For this reason, the government permitted a team to inspect the madhouses. With the report of this team, the government permitted the private practitioners to operate on their own. In France, Dr. Philippine was a medical doctor. In 1793 AD, it is on record that he liberated 50 patients within 1 week. These patients who have been chained for 30 years were allowed freedom of movement. In England, Dr. Williams Luke, 1732 to 1822, a member of the Society of Friends at New York, founded a small establishment called a retreat for the reception of friends suffering from mental illness. In 1796, one of the outstanding features of this institution was its sympathy, understanding, and gratefulness, thus replacing harshness and confinement. He stressed occupation of all kinds, and including gardening for men, sewing for women, as well as assisting the attendants in certain routine duties. In 1808, a bill was passed by the House of Commons regulating the treatment to the madhouses and all other local authorities to do what? To open an asylum for the patient. In 1811, Nottingham County Council established the first asylum in Great Britain. In 1845, a commission set up to examine the state of Britain asylum found that there were shortage of staff. Overcrowding and restraining of inmates, neglect or negligence, and curiosity to inmates. 1814, an American named Dorothy Six was responsible for upgrading the living condition and the standard of care for the mentally ill. In 1845, a lunacy commission was set up, again to carry out improvement in mental or madhouses. That came another era, which is called the Lunacy Act. In 1890, Lunacy Act was passed into law. This act has the following provision. Number 1, all local authorities should give protection, proper care and treatment due to the patient. Number 2, personnel caring for patients should be given proper training. In view of this one, the Medical Psychological Association of Great Britain and Ireland was founded. The first school of psychiatry nursing was established by a physician named Dr. Brown in 1884, and it was approved until 1890. In 1891, the first psychiatry school of nursing exam was recognized by the association, and it was concluded, and the first batch of nursing, of psychiatric nursing, or psychiatric nurses passed. There came the era of which we are today, scientific era, which started in 1819 till date. The 19th century is regarded as the dawn of the new era in the psychiatric history. Gone were the days when inmates were in deplorable houses, hated and misunderstood by members of the society. Superstition gave way to scientific reasoning. Personnel, such as psychiatric nurses, and psychiatrists were now being trained. Today, scientific method of investigation, diagnosis, treatment, prevention, and rehabilitation have replaced the old cruel methods that were known to exist in the Dark Ages. With the recent remarkable improvement, there is a corresponding progress in the training of personnel and proper administration of psychiatric hospitals. The modern treatment available to the patients include approved scientific nursing care, psychotherapy, chemotherapy, occupational therapy, recreational therapy, electroconvulsive therapy, and other proper rehabilitative or rehabilitation. The care of the mentally within this period was greatly improved with the introduction of phenodiazide, a group of drugs, particularly chlorpromazine, hydrochlorides, Lagati has proved very useful. Also, careful attention is given to patient diet as a means of treatment. This has been gradually a movement of public opinion for rejecting the mentally ill to accepting responsibility for their case. People now recognize medical attention. Other fields of human endeavor has also made their own contribution to the development of psychiatry, and such fields include psychology, sociology, anthropology, surgery, and also religion. That would end our story for the meaning branches of psychiatry and also historical survey.